COPD, or chronic obstructive pulmonary disease, is a lung disease that makes it hard to breathe. When you can't breathe, you have more trouble doing everyday activities.
People find themselves more confined to the house. They can't do as much. They can't be physically active. It's something which limits not only from a physical standpoint, but it also diminishes your quality of life as far as social interaction if you don't take care of it properly.
Sheila Zambetti, who enjoys cooking, has been living with COPD for many years.
I always cooked big time and always set the table in the dining room. I loved that. Like I could manage that, but there were still things to do to make yourself happy.
More than 30 million people in the U.S. live with COPD. It's the third leading cause of death, right behind heart disease and cancer. Smoking is the leading cause of COPD. That includes mainly cigarettes, but also cigars and pipes.
It takes a number of years to develop COPD, sometimes decades, and it comes on very gradually, so you don't really even notice it initially. It's just kind of the shortness of breath just sneaks up on you as time goes on.
COPD can also result from long-term exposure to secondhand smoke. That is, breathing other people's smoke, air pollution, or chemical fumes.
They irritate the lungs, and so the way the lungs respond to that irritation is by producing more mucus with the coughing, and if that goes on long term, it actually causes lung destruction.
In a healthy lung, the air you breathe travels down your trachea or windpipe, then through tubes called bronchi, smaller tubes called bronchioles, and finally into tiny air sacs called alveoli. Normally, these sacs are flexible and springy so that when you inhale, they inflate like a balloon, and when you exhale, they deflate.
The alveoli are air sacs, so air passes through the sacs into the bloodstream, and then the bad gas, carbon dioxide, passes out.
COPD is a combination of two conditions, emphysema and chronic bronchitis. In emphysema, the air sacs lose their flexibility, making it harder for them to expand and contract. In chronic bronchitis, the walls of the airways swell, thicken, and make mucus.
The lungs try to clear that by coughing, and the mucus also narrows the airway, causing obstruction, so it's difficult to breathe. And if the mucus sits there long enough, it will get infected and cause respiratory infections.
Certain tests can help your doctor or respiratory therapist see how severe your COPD is.
Perfect.
If you've been diagnosed with COPD and you smoke, it's very important to quit.
If you can stop smoking, you'll probably live longer and you'll feel a lot better with less shortness of breath. All these other inhalers that we prescribe, they don't do nearly as much good as getting off the cigarettes.
If you're overweight, shedding those extra pounds is also key.
When a person's overweight, it makes you that much more short of breath.
Medicines won't cure COPD, but they will help you live better with the condition. Long-acting bronchodilators are maintenance drugs. That means they help you function better day to day. You breathe in the medicine through an inhaler or nebulizer. It keeps airways open and prevents shortness of breath. A metered dose inhaler delivers a set amount of medicine into your lungs.
This is your MDI, and this is the spacer. You want to use these two together.
You can attach a device called a spacer to help the medicine reach your lungs so it doesn't wind up in your mouth.
Deep breath in, hold it, breathe out. Okay.
Short-acting bronchodilators work quickly. They're sometimes called rescue medicines.
You use a rescue inhaler whenever you feel like you're really badly short of breath.
If shortness of breath gets in the way of your daily activities, you may need to breathe in oxygen.
So you might be sitting down and not need oxygen, but when you exercise or walk, your body needs more gas and more fuel to work, and at that time you may need oxygen.
You can get oxygen in a few different ways. Cylinders called concentrators filter the air around you to pull in oxygen and then deliver it through prongs or a mask. But these big units aren't very portable. Compressed oxygen and liquid oxygen come in smaller cylinders that are easier to take with you. Oxygen has helped David Carden be more active again.
Before I started using the oxygen, on some days, I couldn't walk hardly get from my bedroom to the living room without just almost collapsing. And I started using the oxygen, and it just made a tremendous difference.
Another way to feel healthier and live better is with pulmonary rehabilitation. This will teach you how to manage your condition with exercise, nutrition, tips to conserve energy, and breathing techniques.
People after pulmonary rehab almost always notice improvement in their quality of life. They can just do more and enjoy life more as a result.
Living with COPD can be emotionally draining, so you'll also learn how to cope with the stress of your illness.
If you feel overwhelmed, talk to someone. Don't just keep it inside.
If treatments don't work, your doctor might suggest lung surgery. Or if your COPD is very severe, a lung transplant may be an option. Sheila Zambetti has seen improvement in her symptoms thanks to medicines, breathing techniques, and exercise.
Helping to get you through certain hardships. That's what they help you do.
It doesn't matter how bad your COPD is, but if you take care of yourself, take the proper medications, see your doctor on a regular basis, get your flare-ups treated immediately, you can have a good quality of life and enjoy your life for a long time.
To learn more, watch Living Well with COPD, Living a Healthy Life.